next speaker, who's Dr. Sanaz Gabery from the Medical Faculty of Lund University. Sanaz Gabery is a senior postdoctoral fellow as well as an MD, and she's going to talk about white matter changes in the limbic system in Huntington's disease. Sanaz.
Yes. So I'll just start off by just thanking the chairs for inviting me here today to share to you a little about our latest study where we have investigated white matter pathology in Huntington's disease within the Fornix structure. So as it was previously mentioned yesterday that patients with Huntington's disease can also experience a set of psychiatric symptoms such as apathy, depression, altered social recognition, anxiety, as well as irritability. And these symptoms can often occur at an early disease stage, even before the onset of any motor symptoms. But exactly which part of the brain that's involved in the pathology behind these symptoms is still not fully understood. So therefore, in our group, we're interested in looking into regions that might play a role for the genesis of these symptoms. And a region where we're quite interested in is the limbic system, which is a collection of brain regions that are collectively heavily involved in the regulation of cognition as well as our emotional control, and such as happiness, sadness, anger, disgust, love, and surprise. And the main and important white matter tract that's running through these brain regions and connecting them together is called the Fornix. And when it comes to the Fornix itself, it hasn't been that extensively studied in Huntington's disease. And given all the recent white matter changes findings that we have identified, we were then interested in our group to understand how is the Fornix in fact affected in Huntington's disease. And we began by doing this by looking into postmortem hypothalamic tissue coming from HD cases and control cases from the brain banks that I've listed up in the slide. And the reason why we chose the hypothalamus is because this part of the brain, the majority of Fornix is actually running through this region itself. So it gave us a good opportunity to then quantify just the volume of the structure itself. And we could see that, in fact, there was a significant reduction in the volume of the Fornix in the HD cases when compared to controls. And this reduction was then roughly around 27%. We also looked into the oligodendrocytic-like cells within this structure where we performed the serological quantification measurements, and there we couldn't see any significant change between the number of oligodendrocytic-like cells within the Fornix between the HD group and the control group. We then turned to MRI, and as part of the IMAGE-HD study, we again performed volumetric analysis of this brain region. And again here we could confirm that, in fact, the Fornix is significantly reduced in the HD cases compared to controls. But what was quite striking was that we could see that this reduction is, in fact, taking place at an early disease stage, already seen in the pre-symptomatic HD group. That is, patients that are HD gene carriers but have still not developed any motor symptoms. And what was also quite strikingly was that we could see that this reduction in volume was within the Fornix is already present before we start seeing any volumetric changes occurring in other white matter regions such as the corpus callosum. Moreover, we also could see that the Fornix volume itself was also significantly correlating with several important clinical parameters, such as the Beck's Depression Inventory Score version 2, as well as neurocognitive tests such as the symbol digit modality test, as well as the Stroop test. We next then assessed the Fornix itself at an ultrastructural level using electron microscopy. And here we could see that these myelin rings that are comprising of the Fornix itself, they were more disruptive and misshaped in the samples coming from HD cases when comparing them to healthy control cases. And what was also quite interesting was that we could see that, that the levels of myelin basic protein QD9, which is a protein that has been shown to be able to detect fragmented and damaged myelin, was in fact also significantly increased in the HD group. Now, given both these two findings, we could then see evidence pointing towards that there is in fact myelin breakdown occurring within the Fornix in Huntington's disease. We also quantified the levels of myelin regulating factor protein. Now this is a transcription factor that's very important for several white matter related genes, such as the myelin basic protein, PLP1, MOG, MOG, and MAG. And MRF itself has previously been shown to be affected in HD animal models, but here we could see that within Fornix samples, that MRF itself was also significantly reduced in the samples coming from the HD cases. Now, this finding then prompted us to perform a transcriptome analysis, and this we did together with Mahmoud's group, where we performed a transcriptome analysis using RNA-seq on Fornix samples coming from HD cases and control cases. And there we could find roughly around 500 genes that had an increased expression, higher expression levels in the HD cases, and then again roughly around 500 genes that had a lower expression level. And performing ontology analysis, we could see that the genes that were related to higher expression, those were in fact related to terms involving immune activation, and those with a lower expression were involved with terms related to structural organization of neuronal projections. And to identify transcription factors that may account for the differentially gene expression patterns that we've been observing, we used then enriched R to perform an analysis based on transcription factor and target gene interactions. And there we could see that differentially expressed gene between HD and control cases were in fact enriched for binding sites for the polycomb repressive complex 2, the PRC2, as well as REST2. And just as Mahmoud just recently explained, that downregulation of PRC2 has in fact been shown to parallel with the maturation and differentiation of oligodendrocytic-like cells. Now, we've also begun by looking into animal models where we have seen that in the back HD, we could in fact also there see a reduced Fornix volume within these mice starting at 6 months of age. And a multiple comparison test could reveal that the Fornix volume in the wild-type group is significantly increasing between 1 to 6 months. However, this increase in the back HD mice is stopping at 3 months of age. So just to summarize our main findings here, we could see that within the limbic system, an important white matter tract called the Fornix is in fact undergoing atrophy in Huntington's disease. And this atrophy within this structure is present at an early disease stage before the onset of any motor symptoms. And we're also seeing evidence pointing towards that there's myelin breakdown occurring within the structure, as well as transcriptional changes. So with that said, I would just like to acknowledge all of our collaborators for all their contribution for this study, as well as our funding sources. Thank you very much.
Thank you very much, Sanaz. And with that, we have the time for 1 or 2 questions. Okay, you have a question?
For a really interesting talk. I've got 2 questions. How specific do you think are those changes to the Fornix within the limbic system, or would you expect changes, for instance, in the cingulum bundle too? And then secondly, we know that the Fornix plays an important role in episodic memory and spatial navigation, and do patients, pre-symptomatic Huntington's disease patients, show any impairments in those functions?
So for the first question, I think that, well, we've just so far just investigated the Fornix itself. Of course, I can't say it'll be too much of speculation if I say there is other changes, but I would assume that there will be changes in other white matter tracts running through the limbic systems as well. And for the second, I cannot, I don't know if I can get some help from,
okay.
I can't answer to whether or not the spatial in patients, what has been seen in that. But yes, of course, what you mentioned, that the Fornix itself is, has a crucial role for the development of episodic memory formation. So I'm assuming that it needs to, this could then, if these findings has been seen in HD cases, that this might be playing a role in those, in the formation of that.
So my understanding is that pre-symptomatic HD is more associated with subtle executive dysfunctions rather than memory. So if there are such early Fornix changes, it's just, surprising that memory deficits are not more prominent.
Yeah, but I think that's just one aspect. I don't think that it has been completely understood the exact role of the Fornix in humans itself. I mean, there has been very few case studies so far reported. So I think that there's still some caution exactly about what these findings or changes within the structure could in fact mean in clinical settings.
Thanks.
Okay, and we have one more question.
Hi. So I was wondering, it looks like you studied mostly the most anterior slices of the Fornix, but you have the entire tract there. And I was wondering whether you have in plan or you have studied with the diffusion imaging or even volumetry at a more perpendicular level in Fornix?
Yeah, that is things that we are planning on performing and doing, yes. But we haven't done them yet.
Thanks.
Okay, well, thank you very much, Sanaz.